very official.
I appreciate that.
You're welcome.
Except this lab coat should have been washed months ago. But in any case, and this one's a little more complete. All right, some general things. Is this the correct position for my heart?
Yes. No.
No. All right. This is about the way I would anticipate my heart would be positioned. The apex should point to the left, slightly downwards and slightly anteriorly. Right. So when we talk about directions with the heart, we mean approximately. All right, this is approximately an anterior view. Why don't you come around here so you can see there. All right, this is an approximately anterior view. So this is an approximately posterior view. You should always determine which side's anterior, which side's posterior. All right, next thing to do is identify some layers here. What is this shiny surface that I'm touching? Is it smooth and shiny? What kind of a membrane is it? Mentioned several times in the course. You're about to say serous membrane. This is an example of a serous membrane. All right, if you look at this under the microscope, it would have simple squamous epithelium plus connective tissue. And serous implies that a fluid diffuses through that epithelium and then lubricates the movements of the organ. Would this organ move? Yes, because it beats, so it's going to move when it beats. All right, the serous fluid lubricates its movements. All right, so it's a serous membrane. All right, more specifically, it is the visceral pericardium. Why is it visceral, everybody? The heart is one of the viscera. It's a major internal organ, and it's directly on the heart. Pericardium means it's on the heart. An alternate name is epicardium. So it's visceral pericardium, but it's also the epicardium. All right, here it doesn't have any fat, but here it has a lot of fat. So the amount of fat is variable. This animal is probably overfed. We're not interested in the animal's long-term health, I suspect. All right, next thing to do, find the four chambers. And it's not hard to do. Notice this groove with two little blood vessels. This is the anterior interventricular groove. All right? It's a very important landmark to find today. If it's interventricular, what's this chamber and what's this chamber?
Atrium.
All right, this is the right ventricle, and this is the left ventricle. If you're looking at an anterior view of something, its right will be to your left, and its left will be your right. So this has got to be the right ventricle. This is the left ventricle. Another way you know this is the right ventricle is you see a big arterial trunk directly attached to it here. That's got to be the pulmonary trunk. So this can only be the right ventricle. All right, we turn this around. Here again we see two small blood vessels in the posterior interventricular groove. This is the posterior interventricular groove. All right, since this is the back of the organ, its right will now be to your right. All right, so this is the right, everybody, ventricle. This is the left ventricle. All right, but notice here we also see a groove running transversely. There are two names for this groove. You can call it the coronary sulcus, or you can call it the atrioventricular groove. If that's true, what are these two vessels? Or these two chambers, I should say. All right, this is the right ventricle. This must be the right atrium. And this must be the left atrium, because it's directly above the left ventricle. All right, you're probably saying, hasn't this been damaged? Have not the two atria been damaged? You bet. The people that took these out of the pigs were butchers in more ways than one.
So those are
I
pig
regret
hearts?
it. Yeah. In fact, some of them are worse than this. Here they cut off, on this one they cut off most, I'd say they cut off at least half of the left atrium. Here's the interatrial septum, but they cut off the tops of both atria. To compensate for that, we have heart models. So if these are missing parts, again, I have no control over what they sent us. That shouldn't have happened, but notice the two atria combined, as I showed you in the lecture, look like what letter of the alphabet? Let's see. They're C-shaped, and here's the interatrial septum. But what I'm very concerned about is they cut off the superior vena cava on the right side, and they cut off the pulmonary veins on the left side, and that's shameful. The only vein left on this one is the coronary venous sinus embedded in the coronary sulcus, because that was below where they cut it off, but they cut off all the other great veins. What can I do here? We'll do the best we can here. Right, here's the inferior vena cava that's somewhat mangled. Like I say, these guys are butchers, you know. All right, let me see if I have some pre-cuts. Yeah, this is a good pre-cut one we can reuse again. Like, this will save you some time, so you don't have to cut it, you just look at it. I'm going to use those. And if you do the new ones, well, I'll save those as well. Or if you get one that's not yet cut, let me demonstrate how you do it. Everybody ready?
Yep.
All right, use the anterior interventricular groove as your landmark. You want to make the cuts parallel to that groove. Again, I want to emphasize the word parallel. One parallel cut in the left side of the heart, the other parallel cut in the right side. Keep staying parallel to this groove. You don't want to cut across the groove, because if you cut across the interventricular groove, you'll make an artificial connection between the right and left sides of the heart, and you don't want to do that. All right, so to keep the integrity of the right versus left side, make your cuts parallel to the interventricular groove, but one about 1.5 inches to the left, the other about 1.5 inches to the right. All right, use the scalpel, the little knife, only to make a line and complete the incision with the scissors. Notice here, I'm going to just use the scalpel to make a shallow line. Notice the upper end of this line on the left side also cuts the left atrium, which you want to do. And the lower end of the same line cuts through the apex, which you also need to do. On the right side, the upper end cuts through the pulmonary arterial trunk, and you want to do that. Then you stay parallel, and you turn around to the back of the right ventricle, and you cut to about here, but don't cut across the posterior interventricular groove for reasons already stated. So stop the line about 1 centimeter or 2 short of the posterior groove. All right, complete the incision by putting the lower blade of the scissors in the line you made with the scalpel. That's what I'm doing here. And you keep bringing the lower blade in a superficial direction. That way you're hopefully cutting only the outer wall and not the deeper structures you want to see. So I'm following the incision line with the scissors. And also running upwards to cut the pulmonary trunk lengthwise. And here we have a nice exposure of the endocardium. As it's a bright pink color, this pig had a nice healthy endocardium. And here's a true false. Am I touching endothelial cells with my thumb? True or false?
No, true.
True. All right, since there's blood in the chamber, the endocardium includes an endothelium. And fortunately, the endothelium was healthy in this pig. If there's a very unhealthy endothelium here, what dangerous thing could happen? All right,
Myocardial
massive
dissection.
blood clots, and when the ventricle contracts, it could pump the clots into an artery and cause massive blockage. It's called a thrombembolism. A clot that dislodges and becomes an embolism blocking a vessel, sometimes with fatal consequences. So this pig did not die of a thromboembolism. Because I see no evidence of endocardial disease. All right, notice here you see what reminds me of 3 sails on an antique sailing ship. Don't they have a festival where they still have old sailing ships? The Tall Ship Festival. Or this reminds me of the Tall Ship Festival, because each of these sail-like things is tied down at its corners by what? What do you call the stringy things?
Tendons.
Cordy tendoning. All right, but you don't call these sails, you call them cusps. And notice how many cusps are there?
3.
3. That gives the valve its name. What do you call the whole valve? Tricuspid valve, very nicely exposed. And by the way, the cords are the tendons of these little bumps called papillary muscles. There's a papillary muscle. One thing I don't see, and I'm very disappointed, I can't find the moderator band I mentioned in lecture. I think some hearts lack it. Let's see if I can find a moderator band in this one. Here we go. This has got a beautiful moderator band. You see it's right next to the tricuspid valve. It looks like a bridge. Notice it does not attach to the valve cusps. That's a moderator band. For reasons I can't explain, this is the moderator band. All right. For reasons I can't explain, this heart apparently did not have a moderator band. So maybe not all hearts have it, but 90% of them do.
What is the function?
All right, it is a branch of the right ventricular bundle, so it carries pacemaker signals to where it inserts in the outer wall of the right ventricle. It's about the only part of the pacemaker system that's easy to identify for students. But regrettably, in this heart, it didn't develop it. I guess it's not a vital structure, because this heart doesn't have it. All right, another thing here. Still in the right ventricle, here's the junction between the right ventricle and the pulmonary trunk. And notice you see something that looks like 3 pockets. Here's a pocket. Here's another pocket, which I cut through. Here's the 3rd pocket. All right, what do you call this arrangement of 3 pockets? Yeah, pulmonary semilunar valve. Or a semilunar valve is always between the end of a ventricle and an arterial trunk. And notice it does not have chordae tendineae, but you can see that it'll close if blood gets in these pockets and brings them together. On some of the models, it shows this valve shut. So compare that. But very nice exposure of the pulmonary semilunar valve. When does this shut, everybody? All right, during diastole, not systole, diastole. In fact, systole opens the valve by forcing blood through it. But during diastole, the ventricles expand. The suction, very briefly, causes blood to get into these pocket-shaped cusps and shut the valve. So, the drop in pressure in the ventricle during diastole by causing blood in the pulmonary trunk to flow backwards for a fraction of a second shuts this valve, preventing any further backflow. basically do the same thing on the left side, and you should find corresponding valves, but you're gonna have to work harder on the left side. Why? But this will be good exercise for your hands.
Because
It'll make your muscles stronger.
it's tougher, it's like the bigger part.
All right. The myocardium is about 3 times thicker than on the right side. So one pass with the scissor won't be enough. Since I want to make you do the work, use a pre-cut one. Notice how much thicker the wall of the left ventricle is. All right. But here we see its endocardium. What if I tell you between my forefingers is just one papillary muscle? What about its size? All right, notice it's huge compared to the ones on the right side. That's because it has to resist 5 times as much pressure. And notice again, it gives out chordae tendineae. What do you call this valve? Since it's on the left.
Bicuspid.
Bicuspid. So this is braced by very strong papillary muscles, much stronger than on the right. All right, if I was saying, where is the aortic semilunar valve? You take a blunt instrument, the blunt end of the probe, put it behind the bicuspid, and notice it comes out here. That's the aorta. And if you look down in there, the probe is forcing open the aortic semilunar valve. Another way to see the aortic valve is to take a half heart, one of these, which I'll give you, and this will match one of the pictures in your handout. Let's see, I like this one better. All right, here's the outflow of the left ventricle. Here you see the aortic semilunar valve, and here the ascending aorta. If you have a front half, which this is, another thing you can do is probe out the 2 coronary arteries, but being the absent-minded
What are you
person
looking
here,
for? Your probe's in the heart.
Yeah, you left it in the aorta.
now, this is why it's good I'm not a surgeon. I'd be sued. Why? Many years ago, I passed by a lawyer's office downtown, and they had an X-ray showing a tool left inside a surgical patient.
That's nuts.
I assume the lawyer sued for a considerable sum. So this patient won't sue me. But
Pigs can't sue.
not in this country anyway.
Yeah, right?
Or at least not yet. In any case, I've got the probe now in the left coronary artery, but it's hard to see because the fat is covering it. Here's the probe in the right coronary artery. This is the cut right coronary artery right there. If you want to clean off some fat, use the forceps
Use the force.
like this. See how I keep doing it that way? That should expose the coronary arteries, and they're also visible on the models. In fact, those heart models that look like cookie jars, made out of crockery, are some of the best to see the coronary arteries. Here you're going to have to scrape the fatty epicardium off because of the covering. This is going to take some patience here. All right, have exposed the left coronary artery. Let me make it wiggle. I'm wiggling the actual left coronary artery now exposed. It's sort of light purplish color there. All right, that's the left coronary artery exposed by scraping the fat away with the forceps. And you can do the same thing for the right one. Right? All right. Team captains, get a tray, get